Hi, I'm Jim Schoeneck, and welcome to another episode of YPO Presents. As a board director of FibroGen and the chair of YPO's Healthcare Business Network, I'm very excited to celebrate World Mental Health Day with my fellow YPOers, Esha Oberoi, Rhona Mahony, and our special guest, Craig Sawchuk. For those of you that don't know, YPO is a global leadership community of more than 30,000 chief executives in more than 140 countries. YPO is driven by a shared belief that the world needs better leaders. We come together in YPO to become better leaders and better people, and are inspired and supported to make a difference in the lives, businesses, and the world that we impact. In fact, the Healthcare Business Network is a community of more than 2,500 global chief executives working to improve global healthcare through networking, education, and partnership, which is why we are very excited to have this conversation today. And now a little bit about our guests. Esha is the CEO of Afea Care Services, one of Australia's most successful private in-home care services for the aged and the disabled. Dr. Mahony is a specialist in maternal and fetal care at the National Maternity Hospital in Dublin, Ireland. And Dr. Sawchuk is a professor of psychology and co-chair of the Division of Integrated Behavioral Medicine, and also the co-chair of clinical medicine within the Department of Psychiatry and Psychology at the Mayo Clinic in Rochester, Minnesota. Welcome, Esha, Dr. Mahony, and Dr. Sawchuk.
Thank you. Thank you for having me.
Thank you.
Okay, so before we get started, we'd like to remind everyone who's watching live that you can ask our guests questions by posting them in the comments section below, and we'll answer them as time permits. And if you're enjoying this broadcast, please let us know by liking it and sharing it, and also by following us so that you can receive indications about our next episode. Okay, well, let's get on with today's show. So to start, Esha, let me ask, mental health is on the top of mind for chief executives across the globe as they're managing the upheaval and the changing priorities caused by the pandemic. Employees are facing some real challenges. Can you share some of what you're experiencing, seeing in your community?
Yeah, absolutely, Jim. So in Australia, just in the last 6 months alone, we've seen the uptake of the employee assistance program double in utilization. And that's just one indicator of the amount of stress that employees are going through. We've seen this period of extended isolation and restrictions from being able to connect with our family and friends, this real blur of professional and personal lives, and the chaos from homeschooling and managing professional demands, as well as this ever-changing landscape. And I think to some degree we can all handle change. But when there is so much change and uncertainty and unknowns beyond that change, it's really obvious that from a universal perspective, it is going to start to impact our mental health. And that's what we've experienced that in the last 12 to 18 months.
And Esha, just for context, could you let the viewers know how long have you been in lockdown in Australia?
So it's been on and off. And so it's been a real change in restrictions for the last 12 to 18 months. And then in Sydney, where I am in New South Wales, Australia, we've been in lockdown for 3 months now, continuously.
Very good. Dr. Mahony, how about you?
Yeah, so it's interesting. We're only starting, I think, to learn about the impact of COVID-19 on mental health, and we've got lots of studies coming out already, big push to get research out there really quickly. And that sometimes brings a question mark about quality and with the speed that we have, but also we don't have that long-term data. But, what we are seeing is a new profile risk. And particularly for me, that profile risk we're seeing is women. Young women seem disproportionately affected during COVID-19, and particularly young women who are looking after children. And so what we're seeing is a real big increase in eating disorder, seeing an increase in alcohol use disease, domestic violence, and obviously depression, anxiety. So that has been something that's quite new, even though when we look at general data, it can be quite reassuring too. You know, we look at suicide rates, for example, across 21 countries. We're not seeing the increase in suicide rates that was hugely predicted at the beginning of the pandemic. Now, some of that might be reporting. Suicide is always difficult to pick up, sometimes delay with coroner's cases, and also they can be labeled as other things because families don't like the stigma associated with suicide. But certainly across the globe, we're not seeing that yet. We are seeing increases, obviously, in early pandemic with anxiety and depressive disorders, but these seem to be recovering quite quickly as we move on through the pandemic. But the other big category then are obviously patients who contract COVID-19. And again, we're seeing kind of a dual picture there of early symptoms, anxiety, depression, fear while going through treatment, but also the long-term risk of post-traumatic stress disorders, long-term risks of depression. And I guess the other big groups are those that are living alone and the healthcare workers who are tasked with caring for people. We see this particularly in our intensive care units, and we see healthcare workers getting overwhelmed by the duties they're performing, by seeing the level of death that perhaps is unprecedented in some of the units, and the inability to provide the kind of care people really want to care. And again, that sense of being cut off, of being isolated. So that's a big risk, and we're seeing a lot of burnout, which we were seeing anyway in healthcare workers prior to the pandemic, but we are seeing people now getting into trouble, and we are seeing people choosing different careers now, and we are worried in the long term in healthcare whether we will see a big move out of healthcare, and particularly out of the acute healthcare areas, like general medicine, like intensive care, where we so badly need our doctors. And of course, the other big group that are vulnerable are those with pre-existing mental disorders. They are really struggling to access care because obviously a lot of care has been closed because of the pandemic. So routine care, people have not been able to access. And of course, the usual social structures that support people have been missing, which is really exacerbating it. And then we have this very sensational media. I don't know what you were like in countries around the world, but in Ireland, we get a daily diet of crude numbers of people who died. And there's been this constant kind of catastrophizing. And of course, the pandemic is really serious, of course, it's a dreadful thing we all have to live through. But I think at times, the sort of sensational reporting and the constant catastrophizing has been really unhelpful for people who are stuck at home and can't get out during lockdowns and are completely at sea and without the normal nice things that make life a little happier. So I guess in summary, we're seeing really a global effect among all our populations, but new risk profiles emerging, and particularly groups badly hit.
So it's interesting because I know here in the U.S. we've also seen the applications for nursing programs slow down dramatically over the last year, and I think that maybe even some of the not wanting to get into the field just because of some of those stresses that they're hearing about. And certainly in the U.S. we have our share of sensationalist media, more than our share, I think. But just as well, what other quick baseline in Ireland, because people may not be aware, what is the vaccination rate like? And then what do you see a difference with that among that younger female population that you mentioned?
And we're really excited. Today, we're just announcing on all our news networks that we are very close to suppressing SARS-CoV-2 in Ireland. We have almost a 90% vaccination rate in adults, which has been phenomenal. So uptake in Ireland has been really superb. And that is down to really good education around the virus. And I think the social drivers in Ireland, are wishing to get out again, and everybody wants to fly abroad again. And you have to have a certificate to fly in Europe. So I think that's been a big driver in encouraging people to get back out again. Good. We've had a long lockdown, so people really want to get going again. But it's brilliant to see such high vaccination. Without doubt, that is the key for population healthcare, is high rates of vaccination.
Well, congratulations on that 90% number. That is incredible, and I think we are envious on this side of the Atlantic. So, Dr. Sawchuk, I just read this morning that unfortunately Minnesota is becoming one of the hot spots and one of the places where we're seeing COVID cases go up. Can you tell us a little bit of what you're seeing in Minnesota?
Yeah, it's it's great to be able to hear from my colleagues as well too, who come from completely different backgrounds and countries and cultures, but a lot of shared commonalities that are going on. And what I have really appreciated when we look at global uptake in terms of preventive measures and public health measures like vaccinations is that sense of unity and commonality. And I think, I'm Canadian and working here in the US, and that's already a bit of a different cultural difference when I think of the background of being Canadian and the cultural mosaic. Canada was actually out of the gates late with being able to get vaccine supply, but they were able to surpass the US in a shorter span of time in terms of population rates of vaccination. More from that cultural mosaic type of approach, and probably some of the influence of socialized medicine, some of the benefits of that. Whereas in the U.S., there's been some challenges. I think of certain pockets, and working here at the Mayo Clinic in Rochester, Minnesota, which is in southeast Minnesota, our vaccination rates are unbelievably high. And we know that's weird from a North American standpoint, just because the culture of Mayo Clinic, that the vast majority of people seemingly in this region are employed by Mayo, or they've grown up in the culture of that when people come to Mayo Clinic, it's a tough place, for somebody to come to. Sometimes it's their last chance. So I think the mindset of looking out for others, and kind of respecting, maintaining the health and welfare of others has been big. When you step out of that context, I think that's been some of the challenges that we've dealt with in North America, where there's been this look at individualism, and this kind of intertwining of political divide and other heated areas that get around the idea of vaccines. So it's been a challenging time, and definitely some of the media has played a role in that too.
Well, I think we've done a good job of laying out some of the stressors that may be even above normal times. And since this is World Mental Health Day, let's focus, with 3 continents represented here, on telling the audience about some of the differences on mental health care or delivery that may be unique to your part of the world or different to your part of the world. So what might you find surprising? And Dr. Mahony, if I can ask you to go first this time.
Yeah, well, I mean, the big thing we've all found is the acceptability of telehealth. This was something that is well developed in the US, but has not been in Ireland. So during the pandemic, we converted a lot of our routine visits, a lot of our care using technologies like telehealth, and that has been really successful. And we've seen delivery in mental health terms of cognitive behavioral therapy been really effective, and the ability of community services to develop, just to reach out to people so that people can connect and enter into the system. So I think that's something the world is going to continue in Irish medicine, certainly, and hopefully develop even further. I guess vaccination been the big thing, because if you want to minimize the impact, we've gone through that already, of COVID-19 and the impact on people contracting the disease, then vaccination has got a really key part of the healthcare that we deliver. But I guess it's all about trying to increase access to mental health services. It's all about acknowledging within all our workplaces how difficult it can be for people, and so for each organization to have health and well-being programs which are promoting kind of positive adaptive responses to the stress and anxiety that affects all of us, and to the uncertainty that affects all of us. So that's something that we've seen that's been very effective, is just having meetings where we talk about it, sport, physical activity, even connecting online with quizzes and all kinds of inventive things, having concurrent sporting events. All of these things are really important for making us feel connected. At the end of the day, all of us at work, we want to feel that we belong, we want to feel that we're connected, and we want to feel acknowledged. So again, really important that we acknowledge the roles that we do turning up to work, our ability to work, and that there is a future here, because people are uncertain about their future. So it's just reminding everyone, that we will get on top of this. The world will keep moving, and that we will keep going. But I think it's really prioritizing certain areas. And childcare is a big one. Perhaps the most important thing, I think, is keeping schools open. We closed our schools for a long time in the first wave in Ireland from about March 2020 right up to September. And that, I think, will have a massive impact on educational opportunity for children. it disproportionately affected children with special needs and children with lower socioeconomic advantage. And that's something we really need to strive hard if ever we have another pandemic or wherever we have another wave and different variants, to keep the schools open for children.
Well, you mentioned telehealth. Do you see a difference in the receptivity or the interaction with mental health patients versus patients that may have other conditions?
Absolutely. We were not very good at using it in the beginning. We weren't so familiar with it. You know what I mean? So in general medicine, we weren't so familiar with it. We had pilot schemes in Dublin running in cardiology that were quite successful. But we had not extrapolated it to my area of obstetrics, where we're able to give a whole range of antenatal education, healthcare, mental health healthcare online that we had never thought of doing. And in fact, managed to create much greater access to people, and people loved being able to access us in their living room instead of having to come all the way into the hospital. So to some extent, that can break down barriers, but it does require people to have phones or to have laptop and to have that ability to get online. And again, that's where the lower socioeconomic groups can be, disimpacted. But I think mental health is really exciting new experience growing in our ability to deliver therapies online, and particularly at the lower grade of treatments. You'll never completely replace the face-to-face, the one-to-one treatments and those patients who require admission to hospital with mental health disorder. But I think increasingly we realize how much can be done using telehealth, and that's something that's got to be studied. And we are looking at longitudinal studies again at the impact that telehealth can have on treating both mental health disease and indeed lots of other diseases across the spectrum.
Very good. Dr. Sawchuk, how about in your part of the world? What may be different? And maybe you can give us some sense of the difference in the US between what you may have in an academic center and what you might see in the community in terms of mental health treatment and delivery.
Right. So one of the things that that we had just discussed is the use of telehealth and video visits, and just the massive dissemination of that, both in traditional academic medical centers and among our community providers. Part of it was out of necessity in terms of keeping some of these businesses afloat and the healthcare afloat. But hopefully it's going to stay. I think, one of the challenges that we run into is the public health emergency in the US. The public health emergency orders have allowed the cross-state line ability to provide mental health services without being licensed in that state. So when the public health emergency expires at the start of this new year, it'll be curious to see how professional organizations and insurance companies continue to provide coverage, and reimbursement for those services. Again, with being a healthcare professional, is like, it's hard to imagine not doing this. This is part of the greater good, but also one of the challenges that we do run into in North America is the business side sometimes of running healthcare. But I'm remain hopeful and optimistic that we can keep that going. I think one of the other things that I think is a very important change is mental health stigma has gone down. And nobody ever wants a pandemic to come around, but if we actually look across in terms of over the course of the pandemic, there has been a healthier side of the media and social media in terms of viewing mental health as health. I mean, just look at even YPO putting on this presentation about looking at the mental health impact across the board. This is becoming much more part of our normal everyday discussions about healthcare and the importance of addressing this. So even though there's always going to be more room to go in terms of helping to reduce stigma and improving access and engagement to mental health services, there definitely has been positive movement in that direction.
And Esha, how about you? What are you seeing in the land down under? What's different that might surprise some of the viewers?
Well, I think every crisis has some opportunity, and similar to what Rhona's seen there in Dublin, we've seen a real confidence now with telehealth and virtual care, and traditionally we just have not utilized technology to that extent, and I think it's really, when we look at the health constraints, the demand of mental health services and the rise of mental health with the health constraints of a very stretched workforce, virtual care has been extremely positive, especially in all our rural and regional communities. So it's been great to see in terms of the confidence that consumers now have with accessing virtual care therapy. And I think that's going to continue to be something that we're going to see beyond the pandemic, just because it really allows for our under-resourced healthcare workforce to be able to be utilised to its maximum potential. And then the other thing that I think is extremely positive that's come out in the last 24 months is the rise and sort of this adoption of mental health specific apps. So we're really starting to see there's more than now 10,000 mental health apps, or specifically around mindfulness, self-care, that have emerged globally. And I just think that this is going to break down a lot of barriers that we have within community around mental health. So there is still some stigma around going into a clinician's office or parking your car in front of a therapy center and walking in. And I think what an app does is really bring the therapist to your home. It's on demand, which is very much what the consumer of today is expecting in terms of service delivery. It's 24 hours, and if we can do a really good job about through these technology, we're just going to see that they can be discreet, they're confidential, and suddenly we start to break down a lot of those barriers that come from someone having to physically leave their home, go into a clinic, have to schedule it in and go through the whole waiting times, etc. And I think that's going to be really positive. So I'm really interested to see the disruption that's going to come through with a lot of this technology, and really putting, I think what it's going to do ultimately is it's going to be patient driven and consumer driven, as opposed to the system driven, which is how we've traditionally operated in healthcare.
Very good, very good. I have a quick, easy, what I hope will be an easy question for Dr. Mahony and Dr. Sawchuk. Do you mind if we flip to first names instead of the doctor?
Yes,
I feel like we're putting Esha at a disadvantage here.
I know, I love that. I'm only
Awesome,
ever called Dr. Mahony if I'm in trouble.
Very good, very good. Well, Craig, this one we'll ask you to go first. And this is really trying to maybe get away from the pandemic. We've kind of laid things out there, but just in terms of what's happening, we live in such a time where technology is advancing. The Nobel Prizes are being given out this week. But what are the innovations and advancements that are shifting the landscape of mental health? And are there things in technology and behavioral science or in medicine? And can you give us some examples of what you're seeing in academic medicine that people can look forward to in terms of some differences they may see in treatment going forward?
Yeah, well, Esha did an excellent job of predicting the future, because that was one of the big things that I want to touch base on is the mental health consumer is changing over time. Most folks are finding it very convenient running all aspects of their life with shopping, dating, banking, using their phones here. So why not healthcare delivery and mental health services as well too? So this concept of direct to consumer providing options, I think one of the things that we always want to keep an eye on is quality control. And I think that's one of the challenges that we always run into in any consumer related area, and therapy too. There's a lot of things that can be called therapy or therapeutic, but do we know there's an evidence base that's associated with it? So there have been some startup companies over the course of the pandemic who have been doing actually an excellent job with being able to track outcomes, deliver evidence-based interventions, and report on them as well too. And even some of our data is already available that outcomes for in-person visits using cognitive behavioral therapy are very comparable to video visits for cognitive behavioral therapy. So whenever we're looking at innovations in healthcare delivery, we always got to ask ourselves a very simple question: do you know what you're doing is actually working? So a lot of respect going out to businesses that are actually doing that for the sake of healthcare. Some of the other things too, there's always going to be ongoing advances on the biologic side of things as well too. There's ongoing advancements in pharmacogenomics. So as they're testing that can be done to see genetically, are certain folks going to be more likely to have a better response to certain classes of medications or not. It's kind of like in the spirit of precision medicine. And there's also some other treatments going on in terms of rapid treatments for severe depression as well too, and doing ketamine infusions. So there's a lot of studies that are going on out there of looking at what are additional biologic options that are available to us. Again, to really try to look at across the range of psychopathology, ranging from subclinical to mild, what are some lower step intensity things that people are able to do that are good evidence-based, all the way up to more high intensity interventions as well.
Very good. Esha, how about you? What do you see coming down the research pipelines that could help people's lives going forward?
I think what we will really benefit from is the continuous emergence and integration of artificial intelligence in our mental health care model. And I feel that there will be so much benefit for us to take our focus away from diagnosis and treatment to more early intervention and preventative outcomes. So, I guess to that earlier point around being able to utilize, I guess the advancements that I'm really seeing is our Fitbits and our smartwatches on steroids, really taking the diagnostics or the biological, chemical, and mental sort of rhythms and the changes that we go through, monitoring them, and then being able to prevent and predict to an extent a mental episode, to some degree even prevent depression, if we are able to really use technology and artificial intelligence to its highest potential. And so that's sort of where I see it really heading at its highest peak.
It'd certainly be interesting if wearables suddenly could give people a heads up that they were headed toward an episode. When they may not pick it up otherwise. That would be an incredible benefit for the patients and the providers.
I think we're slowly creeping into that world already. If we look at some of the wearable devices and the smart technology that we've got around us, it's already starting to monitor our heart rate, our sleep patterns, and a lot of other things. And I think if we think about healthcare where the patient is really at the center of it, and if they opt into this, and if they and they're sort of part of, or right in the center of this journey, and they're comfortable with it, then yes, like there could be a set of behavioral patterns or emotions that we know will predict depression, and that can be prevented.
Very good, very good. Rhona, how about you? What do you see that can help patients?
I think absolutely goes out saying, using adaptive technology, and we're using so much technology across all healthcare, fields, and that's fantastic. But the first step for me and the big journey in our end is still stigma, back to the very beginning of stigma about mental health disease and mental health disorder. We all love our Fitbits, and we love our heart rate, we love our blood pressure, and we can chat about our sugars if we're diabetic, but we still find it really difficult to talk about negative emotion, to talk about being overwhelmed, to talk about our mental health disorder, to talk about our medication. And that is, I think, where society really needs to engage. We should understand mental health disease just like physical disease. And I think until we really gain that parity, we are still going to see so much unmet demand, and we see that today. We know that so many people are sitting at home and they are really struggling and really suffering, and they're never going to disclose that. They're terrified to disclose it. But, we see this in healthcare workers, particularly because they feel they won't be allowed to work. They'll lose their career. They'll be out of a job. They'll be into very onerous kind of monitoring and treatments they're reluctant, to go for, reluctant to be medicated. So we have got to put a lot of energy and time and use whatever technologies we have, and really divert that into the preventative space. As Esha said, I totally agree, into the wellbeing programs that stop people getting sick. And we have got to really educate our whole society. That's got to begin in school, where it's okay to talk about, having negative emotion. But equally, we don't want to give the whole population disease they don't have. And we've got to be a little bit careful of the wearables and the Fitbits, because there are those people who are, very obsessive. And we see that in the group, for example, with eating disorders, who use the food apps and they're counting calories. They're using the calorie counts on their exercise app, and they can assist people sometimes in actually bringing them further into their disease and actually assisting their decline and deterioration. So there's a whole balance here, but at the end of the day, it is very much going to depend on how society values and deals with mental health. And that means governments investing properly in programs, and it means all of us wrapping around each other and saying it's okay.
Well, interesting. And this actually flows into one of the questions that came in from a Facebook viewer. And Craig, I'm going to refer this to you just based on your position. That's how will medical training need to change to really be able to train the providers on this emerging tech, and what do you do to get doctors and nurses more tech savvy?
Well, a big part of it is that it just has to be part of the DNA, of training. And again, there's tremendous strides have already been happening in terms of infusing more mental health training and the use of technology in all facets of our lives. One of the things that we found extremely helpful, like the type of division that I work in, is that I work actually physically right in primary care, family medicine, and pediatrics. So rather than actually working in an outpatient department of psychiatry or a wing in the hospital, with psychiatry, aboard, we're just part of the usual flow of primary care, family medicine, and pediatrics. We're not seen as a specialty service. We're just part of the whole primary care team, and we're seeing patients where they're first seen. What that also allows us to do is a lot of cross pollinizing. So we're just part of the team. So we're also that opportunity to see patients together with our primary care colleagues, our physicians and nurses, but also our residents and our fellows who are in training. This is just part of the model of care. And it is one of those generational things, over time. But there is a lot of programs, even outside of Mayo Clinic, but a lot of these programs, especially that infuse mental health professionals working, elbow to elbow and side by side by our primary care colleagues, is huge, because, when people struggle, primary care, family medicine, and pediatrics are the first doorway into the healthcare system. So we're catching that opportunity to be able to intervene earlier on.
It's interesting. I know out here in California, at the community college level, they've now integrated the physical health piece with mental health professionals in the same offices, just so that they can address those topics and address it much more holistically.
Right. Yeah. I mean, you think of healthcare behavior or any healthcare changes, it's a behavior, and a behavior really deals with the psychology of things. So again, there's a greater appreciation of that interconnection between mental health, physical health, as just looking at it as health.
So Esha, Rhona, anything you'd want to add on the medical training piece when it comes to these emerging technologies in mental health?
Yeah, I think it's important. It's not just about the technologies, it's how we use them. And I think we need a much greater awareness across the different disciplines of medicine to screen for mental health disorder. I'm an obstetrician, and we sort of tend to go, is the baby moving well? Is there light around the baby? What's the fetal heart doing? That's my bit. You know what I mean? The head is not my bit, and the heart is not my bit. But of course, we have to be, the word holistic has been used, much more holistic. And we have to use all the opportunities we can when people interface with our healthcare systems. I think it's really important that we are screening the whole time in general for people struggling with mental health disorder, because it has a massive impact on physical disorder as well, and people's adaptation to physical disorder, their ability to comply with treatments, their ability to feel well, to feel good, to have the confidence and the well-being to get through the usual diseases we all live through in the day-to-day of life. So I do think it's the awareness piece that is so critical.
Yeah. And just to add to that, I absolutely agree with what Craig has mentioned. I think technology needs to be in the DNA of training right from the beginning. It's the least that, business leaders can offer to employees that are integrating into their workforce. But ultimately, there's also a lot of responsibility within the education system as well to really start to bring in, the conversation of technology and the utilization of technology, to Rhona's point, around, the benefits and the utilization and where it really fits into the whole clinical and health piece.
Very good. Hey, Craig, I'm going to ask you one other, just maybe toward the medical side question, and then we'll move on to another segment of the interviews. There's somebody on YouTube that would like to know, how do you encourage somebody who's diagnosed with schizophrenia, and how do you encourage them to be productive rather than always withdrawn and alone, and get them to participate more in their holistic development of their own mind and health?
Yeah. So one of the things that we always want to do is, for any individual, regardless of what health condition or mental health condition they're struggling with, is also what's the context that's surrounding them, as well too. So we think of what is the stability of their living situation, what's their accessibility to food and other basic needs, what is their social support or other substance related issues going on. So we see it, with individuals, really idiosyncratic, and our goal with doing any kind of healthcare, we even take mental health care out of the picture for a second, is to improve symptoms, improve function. That helps with quality of life. So sometimes, for certain folks that are much more disadvantaged, for example, so if we take, this case in particular with schizophrenia, there tends to be a lot more burden of social determinants of health working against them. There's also greater stigma. So is it less bad to say, hey, I struggle with an anxiety disorder, I struggle with panic disorder, versus, hey, I struggle with schizophrenia? Unfortunately, there's a way different connotation, with that. We also think of the burden of and the complexities of treatment sometimes. So with folks like this, where they're at risk for just being more disadvantaged than other parts of our population, we've got to make sure that when we're investing our healthcare resources, that we're watching for those folks that are most at risk of falling through the cracks. So this is where having a little bit more wraparound services, say with working with a social work or a social work team that's helping them to provide some resources for stability to access food or housing, because having a little bit more of a foundation there is going to increase the likelihood that they're going to be able to not only engage their treatment, but stay with their treatment in a manner that's going to be evidence-based, working with rehabilitation counselors. So there really is this focus on vocation, because we know that work provides structure, provides meaningfulness, provides that sense of productivity, provides social support. These are all actually natural antidepressants, in our lives. So being able to have these and in a healthy way can really help somebody lead a more healthy and productive life.
Very good. Thank you for that. So I'd like to switch gears a bit here. This at the top of the hour, I mentioned that this is obviously YPO Presents, and that we're an organization with 30,000 leaders around the world running companies. Esha, I'm going to start with you. As a leader, how do you model proper self-care at work and at home? And can you share some things personally that you may do and some habits you may have that are there to help optimize your own mental health?
Yeah, I think from my own personal experience, I have had a really deep-seated interest in self-care and mental health for many years now to overcome my own sort of personal limitations. And there's many things that I do. A lot of them are very common, everything from, making sure that I'm having a really nutritious diet to ensuring that I'm exercising and having enough movement, and balancing that with my business responsibilities and young families or young kids. But I think the most transformational self-care for me has been meditation. So I have a daily practice of meditation, and that's completely over the last 5 years that I've dedicated a minimum of an hour a day to meditating. I personally feel I've transformed myself. I've regulated to a huge degree my emotional health. And I just find that space really allows for me to calibrate my thinking, and also connect with my heart. I fundamentally believe that mental health starts in the heart, and from personal experience, when I feel like I've connected with my, grief, sorrow, depression, heartache, and I'm letting go of those things, and giving myself the space to connect with those feelings and then let them go, it just allows me to bring in the better version of myself on a daily basis. So meditation is probably my biggest, that's my self-care hack for sure.
Very good. Thank you for sharing that. Rhona, how about you? What do you do to help take care of yourself and keep yourself mentally healthy?
All classic healthcare workers, coffee, chocolate, no sleep. So
I don't know.
That
sounds more like stimulants to keep you going rather than mental health. Let's hear what you do.
This is real life obstetrics. I know. I do. I mean, like all of us, even doctors are becoming, and actually it's a new thing in medicine almost, that healthcare workers, doctors are becoming aware of things like integrative medicine, where we are aware that if we care for ourselves, and we will care better for others. And believe it or not, this is a relatively novel concept introduced for most of us. During my entire undergraduate career and most of my postgraduate career, there wasn't even a nod to caring for yourself, looking after yourself, to your personal health. It just wasn't there. It was all about go, go, go. For me, it's exercise. I'm being out in the air. I live in a beautiful part of Dublin, thankfully, close to the sea, and I run on a cliff. And it is one of the most spectacular runs in the world, probably. And when I am out there, I feel very minimized, if that makes any sense. The world has been here for centuries. I'm only going to be here for 70 or 80, and that's quite liberating. So there's really nothing that I'm going to do or not do that hasn't been done before. There's nothing new under the sun. So that makes me feel quite at ease. Nature has always been something that suits all of us, and we've seen this in the pandemic, so many people reconnecting with nature in a really beneficial way. So it is all about trying to, and also talking about things. I have really great mentors, and for me that has been helpful as well, to have those close, trusted confidants that I can talk to in the darkest hours and share my darkest thoughts with, and be absolutely honest and straight about where I am. And I have found that to be one of the most important things. So I think, like everything, it is eating, moving, sleeping, and really good, trusted colleagues and good family around us. I mean, they're the things that make us take that sense of connection and that sense of belonging.
No, it's interesting you mentioned that, because one of the pillars that certainly makes YPO work is trust.
Yeah.
And the way we build trust, and we'll share confidentially, because it is tough. It is tough, whether it's the pandemic or not, and dealing with the stressors that are there for anyone at the executive level. But Craig, how about you? What do you do to stay mentally resilient?
I loved Rhona's description of running by the sea and the beautiful landscape of Ireland. So I'm in southeast Minnesota, so running through cornfields usually is the premise for a horror movie of sorts. So I'm definitely not doing any running around. But some of the things that I find to be helpful, and in certain parts of time, literally, it feels like survival skills at the very basic, is really trying to get a regular sleep routine. And this is, fair for anybody. Like, I try to think of the patients that I recommend to. I work in primary care, so I work with a ton of healthcare providers. I'm a healthcare provider. We look at, the CEOs and other business leaders that are part of this group. We got to take some of that advice. So even just trying to get a normalized sleep schedule to at least build some gas in the tank. We all know what it's like to be operating when we're sleep deprived. So if there's one low-hanging fruit that we may be able to go after, it's really kind of working on sleep. A couple of other things that are helpful to me. One is just deliberately looking for humor, because our brains are naturally hardwired for threat, and boy, we're marinating in threat everywhere all the time. So taking moments throughout the day, or being very intentional when we actually do have some downtime, is trying to cultivate humor in our lives. And I mentioned a little bit earlier, I'm Canadian from both an Irish and Ukrainian descent. So another thing I like is my wife and I going out for a pint every once in a while, going to a local pub and just being able to decompress and to not have to be on, not have to be making decisions for a change, just being able to, basically kind of chill out and relax and not have to be on.
And I will note there that you said a pint, as in one.
Well, I'm Canadian, so I could have said A-E-H, comma,
that's
pint.
fair. That's fair. That's fair. So, Craig, I'm going to stay with you on this. And that's, if you talked about sleep, you talked about the self-care pieces for the people that you work with. How do you help implement that actually as a practice or an initiative within the workplace? I mean, what can you do as a leader in healthcare to help the people that are working with you take care of themselves?
Right. So number one is that we always have to watch out that any messaging coming from any leader or organization does not come across as blaming the victim. Like, you need to sleep more, you need to exercise more, you need to eat better. And I think that's one of the risks that we run into, wherever we're trying to encourage and promote wellness and resilience in any kind of setting. So we have to just be conscientious about institutional messaging, and are there opportunities within the institution to, whether it be create physical built spaces that are available for decompression, messaging that's encouraging people to take time off, from their work and use their benefits. Can they expand benefit packages so that the cost or the time isn't completely being shifted on to the individual? So one of the things, if we think about sleep in particular, that was one of the number one symptoms. Sleep disruption is one of the number one symptoms you see in primary care, and certainly over the course of the pandemic, that's just been amplified with the scope of folks. So we've really adopted this force multiplication type of idea. There are excellent evidence-based behavioral interventions for insomnia. So very early on, we know that we don't have enough providers to be able to do individual work with individuals. So we went about training our social workers and other healthcare providers in evidence-based behavioral treatments for insomnia. We developed what was called an interactive care module, which is a free-to-use online resource that our employees could use for the behavioral management of insomnia. So it kind of models, some of the really good and free apps that are out there, but making it more, homegrown as well too, and being able to disseminate that out. And again, having it as a free option that's readily available, to our employees and their dependents, so that we're reducing, barriers to care.
Very good. Rhona, can you give us a couple of minutes on what you may do in your healthcare community to help those around you?
Yeah, absolutely. So I think, again, I mentioned before, but the key things are making people feel safe, making them feel they belong in the organization, and making sure they know they matter and that what they do is really important. And for us specifically in medicine, one of the most important things I find is a debriefing session after a call. So we've been on, we do 24-hour call shifts. So I always have breakfast with the team after 24-hour call shift, and we just talk about what's happened during the night and the cases. And as the older lemon now, I may say, oh my God, I did much worse, or I had that before. And it's always to give examples of where you've struggled too, and where you've had a similar case, so that there is an egalitarian kind of approach, and people realize that it can be a tough job sometimes, and that it's not a blame, but it is about learning and doing better, but that there is a very safe kind of environment. We have a very simple thing, a coffee room in the hospital. It's really cheap, and cups of coffee are pretty cheap, and we can make tea as well, and there might be a bit of biscuit there if you're lucky, but it's for everyone. It doesn't matter what rank you are. We don't divide into consultants or juniors, and we all meet, and that's fantastic, so that we get to mix in a very simple way, and we get to know each other, and we get to chat, and that really informs us when we're in the middle of a big emergency, because we kind of know each other. We know with a lift of an eyebrow when someone's getting uncomfortable.
Yep.
And then we have different social events, like the usual sporting events. But the best one is we have a pantomime every year in the hospital, and it's just crazy where we tease each other. It's very affectionate, and we try not to cross the line of being rude or mean. But you have to be able to laugh at yourself, and that is one of the most effective things, because we have so much fun planning it, writing it, and actually filming it. And we've made some very sophisticated films. So things like that. And again, it's not a rank related thing. It's about us as people. And that's what we want to see at work, is not just the task that we do, but we want to see the people that we work with. So I think it is. And also then the big piece also is recognizing talent and promoting it and encouraging it. You know, I had so many mentors, and I mentioned them before, but who helped me come through the ranks as a young doctor, taught me how to operate. It's our job then to make sure that from the bottom up, we are encouraging people and spotting them, and making sure that the organization is there to facilitate their learning, and particularly get someone who's hungry and ambitious. You need to feed that, because they will give back in spades throughout society in every way. So it is about people, every organization. And yes, we will have technologies, and yes, we will have protocols, and yes, we will have systems. But at the end of the day, every organization is a function of its people, and how well they belong in the organization, how supported they feel, so they can really reach their full potential. And when people are scared, when people are uncomfortable, their quality of care, their quality of production is reduced.
Very good. Esha, you've got a little bit different situation. You're in a for-profit business versus a couple of people that are in hospitals here. What are you doing to help support the people in your work environment?
So our mission, our purpose is caring for people you love. And many years ago, we decided to extend this to all of our workforce as well as not just our clients. We didn't want to limit that purpose to our clients. So in terms of self-care, mindfulness, mental health, that's sort of been ingrained in our culture for many years now. In fact, we won third best place to work in Australia and New Zealand at the end of last year, November 2020. And one of the stats that came out of that was 95% of our employees believe that mental health is a number one priority in our business. And I was really proud of that. I was really proud of the fact that our people know that their mental health and their self-care is just so of prime importance. So whether it's our engagement program or awards or recognition program, it's all embedded. We have a very holistic approach to well-being and the whole wellness journey when an employee starts with us. You know, everything from meditation to yoga to like dance to fun. And we sort of try and capture all interests, because self-care is so unique to every individual. And you know, to Rhona's point, it's really about putting your people first and really looking after them, so then they can deliver the highest level of care to our patients and our clients.
Very good. And Esha and Rhona, the last question is for you, just to reflect on your personal journeys. And Esha, I'll ask you to go first. And that's, as industry leaders and as members of YPO, what are the benefits that you or your family have enjoyed by belonging to YPO? And what do you think that founders, entrepreneurs, and other business leaders can gain by being part of this community?
I have been in YPO for 12 months now, and it has been fabulous to be part of this group, especially through the pandemic. Like I think it's seriously the most valuable professional investment that I've made, to be able to connect from a peer-to-peer learning perspective, to share ideas, have an ability to connect with a very diverse group of leaders globally. And then, you know, just not to mention all of the events that we've had all virtually till now, but have been exceptional value in terms of the insights that we are able to get as YPO members.
Very good. Rhona, how about you? What have you seen, and what would you say to people? Esha's been in a year. You and I have been in a little bit longer. So me particularly, but I'll let you go.
I have loved the sense of being in a sort of a team. I feel like I have a new family in YPO, literally. So within my forum, there's a group of 10 of us, and we've been in the same forum now for 6 years. And honestly, I can absolutely, we come back to trust, rely on each member of that forum to have my back, to give me sometimes good advice, to tell me when I'm, you know, on the wrong track, and to be quite tough on me and to hold me up to accountability. But there's huge love actually between us all in our forum. And then of course there is the wider exposure to incredible people that I would never have met if I hadn't joined YPO. Sometimes I have to pinch myself when I'm at different meetings, and I'm meeting different CEOs and enormous global organizations, and you just think, gosh, I was born in 44 Mayo Crescent with Healy Dublin 5, so it's given me literally like a window onto a world that I would never have experienced if I hadn't joined YPO. It's given me enormous mentorship, information, opportunity, networking, but most of all, it has given me some of the finest personal relationships of my life that I will ever have. And I know that I have friends now that will be with me, please God, until I depart this mortal coil. And for that,
Terrific.
I'm grateful.
Thank you. Hey, Craig, I'm going to throw one to you but it's got to be 2 minutes or less because we're approaching the top of the hour. And one of our viewers on LinkedIn wants to know, how do you think we can help team leaders with their teams to have good mental health and avoid burnout? If you were going to give a 1 minute lecture, 1 minute piece of advice to a team leader, what would you tell them to keep their team strong mentally?
Well, stop the pandemic. That would help.
Okay, I don't think the team leader is going to be able to do that. So what can you tell the team leader that they can do? Let me qualify that.
The number one thing and is building a sense of community. And I think that this is where there's already been like some phenomenal ways that both Esha and Rhona have talked about different ways in their own organizations of how do you actually build that sense of community at the same time when we're facing a global pandemic where we're trying to treat it by staying away from each other. So being creative with building that sense of community, recognizing people for the things that they're doing, kind of uplifting. And then one last thing is from a leadership perspective, yes, negative news is going to be part of it, but trying to keep that regulated and really focusing in on what are we doing, what are we accomplishing, how are we going forward. So once again, it's kind of watching the messaging, because remember, our brains are already pre-wired to pay attention to threats, so we got to balance that out.
And I would say don't underestimate that some of the social media outlets can start to focus on what they believe you want to see and read. So if you're seeing a lot of negative, they may feed you a lot more of it. So just be very careful on some of those outlets.
Yeah, if you
so
think on a dietary standpoint, 15 minutes a day, half hour max, and you ought to be good.
Very good. Well, I want to thank all of you. And as we conclude this episode of YPO Presents, I want to thank our guests, Esha Oberoi, Rhona Mahony, and Craig Sawchuk for tackling this important subject, and to all of you who tuned in to be part of our conversation today. If you enjoyed this episode, please let us know by sharing it with your friends, followers, and your connections. And don't forget to follow us on Facebook, LinkedIn, Twitter, or YouTube so that you can be one of the first to learn about our next episode. Again, I'm Jim Schoeneck, and this was YPO Presents Ask the Experts for World Mental Health Day. And thanks for watching, and we look forward to seeing you again soon.
Thank you.